Okay, here we are. So, welcome everyone. Today we are going to be talking about outcome measures, and specifically those that are going to support your pelvic health care specialty. And this is a really exciting topic because outcome measures help to track progress for our clients, which is really, really important for clients to understand the outcomes that they're achieving, and also really important for our notes, for documentation, and for what we're presenting to the other healthcare providers that our clients might be experiencing. So here we go. So if you're not familiar already, we are the Pelvic Acu. And at the Pelvic Acu, our mission is really to empower acupuncturists to successfully and sustainably treat pelvic health clients. The way in which we do that is because we as acupuncturists have such good positioning to understand biomedicine, which means we're looking at the musculoskeletal dysfunction, the sinews, we're looking at the joint structures, the ligaments, the tendons, the fascia, the diaphragms to really address the physical body. Beyond that, our TCM diagnostic skills are so amazing for organ function and organ system patterns, right? How the organs are communicating together as one within the body kingdom. On top of that, our medicine is amazing for treating the spirit and the emotions. When we're talking about pelvic care, there is so much to be said about tending the spirit and tending the emotions. So let's get right into where we're working today. The first and perhaps the gold standard of outcome measures is the PFDI 20. The PFDI 20 is the pelvic floor distress inventory. It is a validated patient reported outcome measure. It's used to address symptom distress, which is really important to make that distinction. So, symptom distress, which is caused by pelvic floor dysfunction across the domains of urinary, colorectal anal, and pelvic organ prolapse. So, urinary, of course, includes leakage, urgency, and frequency. Colorectal anal includes constipation, incomplete emptying, and fecal incontinence. And pelvic organ prolapse includes that sensation of bulging, pressure, or tissue descent. Oop, wrong way. There we go. So, why use the PFDI 20 or any outcome measure? Well, in the case of the PFDI 20, it is a standardized outcome measure. So, it provides quantifiable data to track symptom changes over time. It supports evidence based practice, which aligns with research informed pelvic care. It validates the patient experience. So very often, pelvic health clients feel that they're not seen and they are not heard. By having an outcome tool like this, we're giving a voice to the burden that our clients are experiencing and to those pelvic symptoms. We're saying, yes, this is real. We hear you. We see you. We want to help you. It's also going to help us to identify priorities for the client, right? If they have a whole list of symptoms, and sometimes our pelvic health clients do come in with a whole list of symptoms, we're able to then prioritize what is affecting them the most in a symptom way. And then some of the other tests that we'll use will help us to determine what's affecting them most from a quality of life perspective. This can help us to guide our treatment planning. Now, of course, we're not going to be using just a outcome measure, right? We're going to take our formal history. We're going to use our outcome measure, maybe one or two outcome measures. We're going to use our palpation skills. We're going to use our pulse and our tongue to come up with a treatment plan. But the PFDI 20 or any other outcome measure can help us with our treatment planning. This also helps us to improve communication with our clients, right? And it takes the edge off of the vulnerable conversation. If you have the PFDI 20 or another outcome measure built into your history form for someone coming in for pelvic care, then they're going to start to feel comfortable talking about their symptoms. They're going to feel like you can understand the language that they're speaking and have that sort of interprofessional documentation between yourself and other providers. And this is really important for us as we're working with professionals in the field. Also, this is going to be supportive for your insurance notes if you take insurance or if you have a chart audit for any reason. Building a case for medical necessity, right? If you can show dysfunction within the symptom inventory, then that can be a quantifiable impairment to justify ongoing or specialized care. And finally, it encourages patient engagement. And this is so important. So many clients that are dealing with the discomfort of pelvic symptomology dissociate from their body because it's uncomfortable, because their quality of life is impacted. We want to bring them not into the trauma, but we want to bring them close enough into their body that they can have engagement in order to see improvement over time. The other part that I love about this is while they might be coming in with primary complaint that impacts their bladder, we might see symptoms start to improve in their colon first, right? In their constipation first. This is something that we gauge at like a reassessment period. And when we do this, it's like, okay, so the leakage has improved by 50%. That's great. But look at this. You haven't been constipated since we've started our work together. So the PFDI 20 is a beautiful, beautiful tool to bring in to really help support. I think there's a lot of benefits for use there. So when would we use this? I've sort of already alluded to this, and you'll see this slide multiple times with the outcome measures we're going to be talking about today. So a great time to use this is at the initial evaluation as a baseline functional assessment. Progress note, reevaluation, which could demonstrate improvement or hopefully not, but continued impairment. And then finally at a discharge summary. I want to say as well, and I didn't put this in the benefits of use, but the PFDI 20 is actually useful for all genders. The prolapse section is a little bit yet less useful for those assigned male at birth. However, both genders are able to use this tool. So let's look at it. Let's have a look. Caitlin has posted in the chat for you guys the PDF. If you're listening to the recording, you'll have access to a link with all of the tools that we're talking about today. But for now, we could go through each section. So first, we'll look at the pelvic organ prolapse distress inventory. So you can see that when you give this section to your client, they have the opportunity to say no or yes. And that no is a 0. Yes is scored from 1 to 4, 4 being severe and 1 being minimal. So we ask questions like, do you usually experience pressure in the lower abdomen? Do you experience heaviness or dullness in the pelvic area? Do you usually have a bulge or something falling out that you can see or feel in your vaginal area? Do you ever have to push on the vagina or around the rectum to have a complete bowel movement? Do you usually experience a feeling of incomplete bladder emptying? Do you ever have to push up on a bulge in the vaginal area with your fingers to start or complete urination? So these questions, if you haven't been spending much time in pelvic care, or if you have not worked with clients with pelvic organ prolapse or have not experienced it yourself, these questions might seem like they're a little bit out there. But if someone is dealing with prolapse, these are very, very common sensations that they feel. one of the most common statements that you'll hear from someone who might have a prolapse and doesn't know it is that they have to push into the vagina to either have a bowel movement or to empty their bladder all the way. So this is important for us to know. These are the most common questions based on symptomology. The colorectal anal distress inventory is very similar in its questions. Do you feel the need to strain too hard to have a bowel movement? Do you feel you have not fully, completely emptied your bowels at the end of a bowel movement? Do you usually lose stool beyond your control if your stool is well formed? Do you usually lose stool beyond your control if your stool is loose? Do you usually lose gas from your rectum beyond your control? Do you usually have pain when you pass your stool? All of these questions give us information about the colorectal anal health. Urgency is another one. And then once again, does the part of the bowel ever pass through the rectum or bulge outside? So these are really important questions for clients that are having this type of distress. Finally, we have the urinary distress index. And this is frequency of urination, urine leakage related to coughing, sneezing, or laughing, difficulty emptying the bladder, and then pain or discomfort. When we're talking about urinary distress, colorectal anal distress, and pelvic organ prolapse, there is often carryover that exists between all categories. And that's what I love about the PFDI 20 is you'll identify what the primary area of need is, but you'll also identify any other areas that might be impacted as well. And there's always a little bit of spillover. So this is really good to see. So in summary, I wanted to make this really, really easy for you guys to score. So I tried to really simplify the process. And the PFDI 20, named 20, it has 20 questions. There are those 3 subscales, right? Pelvic organ prolapse, colorectal anal, and then urinary distress, right? And then the item scoring goes from 0 to 4. And then what happens is you add the answers up within each of the subscales and then divide the number of items answered in that subscale and multiply by 20. Each subscale ranges from 0 to 100. So then the total is going to have a range of 0 to 300. The higher the score, the greater symptom distress. If you take insurance, I don't personally take insurance in my practice, but if you do take insurance, I wanted to make sure that I was inclusive. And when we do insurance notes, adding in scales such as the PFDI 20 can be really helpful. So I took this reference, Barber et al. From 2005, to basically give you a quote that you can use with your note to justify why this is an appropriate outcome measure and why this is valid for treating this client. So I mentioned that the PFDI 20 is all about symptomology. The PFIQ 7 is a brief, validated, patient-reported outcome measure designed to assess how pelvic floor disorders impact a person's daily activities, social relationships, and emotional well-being. So therefore, it goes into quality of life a bit more than the PFDI 20 does. When these 2 tools are used together, we get to see both the symptomatic burden and the impact on quality of life. The PFIQ 7. Benefits of use. It is going to it's going to capture the functional impact. So it will identify how the urinary, colorectal, and prolapse symptoms disrupt daily living. If you've listened to any of my classes before, in particular my ethics class, you know that pelvic floor dysfunction, pelvic floor pain are highly correlated with quality of life. So if those dysfunctions exist, they're associated with a diminished quality of life. This tool I love because it complements the PFDI 20 well. It's a great tool, once again, to track progress. It has been researched to be sensitive to clinical change and support the evidence of functional improvement. Functional improvement is key. It's going to once again support patient-centered care, highlight what is most meaningful to that client. That client may find the most meaningful thing that they can go out of the house without feeling uncertain about whether or not they're going to have to change their pad, about their own smell. You know, it can be very, very intimate, and people can restrict their activities significantly if they have these type of conditions. So this helps to bring it back to the patient and helps to track progress for it. Super efficient because it is only 7 items long, which I love. And this one is actually validated across a variety of cultures and has been translated into multiple languages: Dutch, Spanish, Persian, and Japanese, just to begin. There we go. So once again, we would use the PFIQ 7 at the initial eval, at progress notes, and in the discharge summary. So I've done the same thing for you guys here. I've brought it out, but you'll also have access to the PDF. So this asks questions. You can see there are 3 categories once again. So bladder or urine, bowel or rectum, vagina or pelvis. So while there are only 7 questions, we have multiple categories, that 3 categories in which they can be impacted, right? So the premise of the question is, how do your symptoms or conditions usually affect your ability to do household chores like cooking, laundry, and housekeeping? So they would answer that based on bladder, on bowel, and on pelvis, right? So it could be not at all, somewhat, moderately, or quite a bit. How do those symptoms or conditions impact physical activities like walking, swimming, or other exercise? And they fill out 3 categories. How do those symptoms impact entertainment activities such as going to a movie or a concert? How do they impact the ability to travel by car or bus for a distance greater than 30 minutes away from home? You can start to see with questions 3 and 4 here that we're really starting to get into the quality of life impact for clients that have pelvic pain or pelvic floor dysfunction. In the last 3 questions, how do these symptoms affect one's ability to participate in social activities outside the home? How do they impact the emotional health, nervousness, depression, anxiety, etc.? And do they impact one's feeling of frustration? Right? So we're really playing into the emotions. And the thing that I love about this questionnaire is that it is so simple, but it also gets into depth of the emotions. And when we have the client in front of us, we can say, I looked at your intake form and your outcome measures. And one of the questions that we asked was about frustration. And I noticed that your pelvis really impacts, you said quite a bit, it really impacts your feeling of frustration. Can you tell me more about that? And very often that's a window into building rapport, and also for those clients to be able to talk about the things that they've been unable to talk about up until they see you. So once again, I've summarized the scoring here for you. It's the same sort of system of the urinary impact, the colorectal, and then the pelvic organ prolapse impact. Each item has a score to it. And then we sort of use the same range that the PFDI 20 did. So the higher scores are going to have the greater impact upon quality of life. It ranges from 0 to 300. Once again, I've created a statement for you guys about using the PFIQ that you can use in your insurance notes, or you can use when you're telling providers that are in your area. So if you're connecting with a naturopath, if you're connecting with an obstetrician, a gynecologist, primary care, whatever it might be, and telling them about the outcome measures that you're using as you've brought pelvic care into your practice, you can utilize these quotes as well with the reference. This is another reference from Barber. So another assessment that we can use is the Female Sexual Function Index, FSFI. This is specific to female sexual function over the past month. It really wants to assess a 1 month in time. It's validated and it's a multidimensional self-report. It's used widely in clinical practice and in research in the fields of gynecology, urology, psychology, and integrative pelvic health. It provides a way to effectively and structurally evaluate sexual health well-being, dysfunction, and changes following treatment or different life stage situations, for example, postpartum and menopause. The other scales that we mentioned do not really look at sexual function. The FFSI comes in and gives us that information about sexual health. So if we have a client that's coming in with vulvodynia, for instance, the FFSI is a great tool that we can use for that client. The benefits, once again, this is a comprehensive yet brief tool. It's going to cover 6 essential domains of sexual function in just 19 questions. It's validated across populations. It is extensively studied and translated once again into multiple languages. It is sensitive to treatment change, which is exactly what we want. That means it's useful for evaluating the effects of acupuncture, pelvic rehab, hormonal therapy, or even counseling, which is great. And it'll assess all of them in commune if that's what's happening for someone. It integrates well with pelvic care. It's going to connect directly to concerns like dyspareunia, pelvic pain, lubrication, desire, etc., all of which, really interplay with what we're seeing for pelvic floor dysfunction and what's happening within those TCM imbalances that we're identifying through the pulse and the tongue. And of course, it's going to support holistic documentation. So sexual function is a vital sign of pelvic function. Sexual function is a vital sign of pelvic function. Sexual dysfunction is a vital sign of pelvic dysfunction. So it's also going to have this dimension of overall quality of life as well. I find that another benefit of using the FFSI is that it helps clients to start to be comfortable talking about their sexual function or dysfunction and to feel that this is a safe place in order to do that. Once again, documentation here should be at the initial eval, progress notes or reevaluations, and in the discharge summary. This is what the FFSI looks like. So it says, over the past 4 weeks, how often did you feel sexual desire or interest? And this scale is actually interesting because it starts with 5 and goes down to 1. So there's no 0 in this scale. It's a 1 to 5 scale. And then 5 is almost always or always. 4 is most times, 3 is sometimes, 2 is a few times, and 1 is almost never or never. And these numbers actually change throughout the scale, like what they're for. So if you look at question number 2, over the past 4 weeks, how would you rate your level, degree of sexual desire or interest? So the first one was about frequency, how often, and the next one is going to be what's the level. So 5 is very high, where 1 is very low or none at all. Next question we're looking at is, how often did you feel sexually aroused during sexual activity or intercourse? This one does have a 0, and that is no sexual activity, which is essentially the same as leaving the question blank. Question number 4, How would you rate your overall level of sexual arousal during sexual activity or intercourse? How confident were you about becoming sexually aroused during sexual activity or intercourse? How often have you been satisfied with your arousal during sexual activity or intercourse? And we continue on. We talk about lubrication. So, frequency of lubrication, difficulty with lubrication, maintenance of lubrication. And then continuing with lubrication. And then we continue with when you had sexual stimulation or intercourse, did you reach orgasm? This is another important question. So then we go into those questions of orgasm. And that continues with the satisfaction with one's ability to reach orgasm, right? Then we go deep. How satisfied have you been with the amount of emotional closeness during sexual activity between you and your partner? Now, this can actually be an interesting question because it can show us that the emotional side of the client. It can also show us when the physical and the emotional are wrapped together and interfacing with each other. So these are really important questions and they're unique, and I think they're very beneficial, which is why I love this assessment tool. How satisfied have you been with your sexual relationship with your partner? And then the last set of questions are a little bit broader. So, how satisfied have you been with your overall sexual life? How often did you experience pain or discomfort during vaginal penetration? How often did you experience pain or discomfort following penetration? And then, how would you rate your level of discomfort or pain during or following penetration? So, once again, frequency as well as intensity are measured here. And so we've got the scoring for you once again, 19 items, 2 about desire, 4 about arousal, 4 about lubrication, 3 about orgasm, 3 about satisfaction, and 3 about pain. Each item is scored 0 or 1 to 5, depending upon the item. And then the domain scores equal the sum of the item scores times a domain factor. And then the total FSFI equals the sum of all domain scores. So there's a range of 2 to 36. Higher score equals better sexual function. Lower score equals lower sexual function. Once again, I've included a statement here for your insurance notes. This one, the reference is Rosen et al. From 2000. The references are a little bit older and less modern. I like to find references that are a little bit closer together, but these indexes and these scales have actually been in use for so long that the originating references come from the early 2000s, which is when these scales were developed. So the FSFI was administered to assess multiple domains of sexual function, including desire, arousal, lubrication, orgasm, satisfaction, and pain. This validated outcome measure provides a comprehensive evaluation of sexual health, an essential part of pelvic floor function and quality of life. Tracking changes in FSFI scores support evidence-based documentation of improvement and medical necessity for integrative pelvic care interventions. So there you have a quote that's useful once again for insurance and useful for collaborations reaching out to other providers. For your clients that have pelvic organ prolapse, I've included a scale specific to pelvic organ prolapse because I feel that it is important to go just a little bit beyond what the PFDI 20 and the PFIQ 7 go into. So this is a brief validated questionnaire to assess prolapse-specific symptoms and their severity in individuals experiencing or at risk for POP. It is a focused view of prolapse symptoms distinct from general pelvic distress. So that's really important here and can be highly beneficial for clients that are experiencing prolapse and for evaluation. So benefits of use here, this is prolapse specific. It measures only prolapse symptoms, which is great. It is validated for responsiveness. So once again, it's sensitive for clinical change after pelvic floor training and other conservative therapies. It is simple, 7 questions. I love these 7-question tests. They're just the best. It's applicable across populations. So it has been tested. This is the other reason I love it. It has been tested from mild to severe prolapse, pre and post intervention, which means that it's able to track subtle change in multiple populations, which is benefit number 5. It really captures those shifts in heaviness, bulge, pressure, incomplete emptying sensations, often reported with pelvic acupuncture care. Once again, document this at your initial eval, your progress note, and in your discharge. So here are the questions. As I mentioned, they're quite simple and they only have one series of questions because they deal just with prolapse. And we have only one scale in this case, never, occasionally, sometimes, most of the time, to all of the time, 0 to 4. So our questions are, in the last 4 weeks, once again, specific to the last 4 weeks, has one had a feeling of something coming down from or in the vagina? An uncomfortable feeling or pain in the vagina, worse when standing, heaviness or dragging feeling in the lower abdomen, heaviness or dragging feeling in the low back, a need to strain or push to empty the bladder, a feeling that the bladder has not emptied completely, and finally, a feeling that the bowel has not emptied completely. So this pelvic organ prolapse assessment is a great one to have to add into your practice specifically for prolapse. Here's the scoring for it. It's pretty simple scoring, 0 to 4, as I mentioned, all 7 items. Add the items together. There's a range of 0 to 28. Higher scores equal more severe prolapse symptoms. Less scores, mild. I've once again done a quote for you to share with other providers or for your insurance notes. And our last test, I wanted to have a test that was specific to the assigned male at birth population. So this is the NIHCPSI, which is the Chronic Prostatitis Symptom Index. It's another validated multi-dimensional questionnaire, which is used to assess pain, urinary symptoms, and quality of life in men with chronic pelvic pain syndrome or chronic prostatitis. It's really considered the gold standard for a men's outcome measure. So benefits of use here, it's validated and standardized. It targets male pelvic pain. It's quick and easy, just 9 minutes, less than 5 minutes to complete. Once again, it's another highly responsive test, so it's sensitive to clinical changes, which is great, and it supports a holistic treatment plan. Once again, helps us to build rapport with this client population. There are many men with chronic pelvic pain. They also have anxiety, tension, or stagnation patterns, right? This tool is going to help us to quantify that impact. Once again, here's when to use these outcomes: initial eval, progress note, and discharge summary. So let's have a look inside. Okay. So in the last week, have you experienced any pain or discomfort in the following areas? They're going to be yes or no for some questions, and then there's going to be a scale for other questions. So this one's a little bit harder to standardize in the way of just yes or no, or 1 through 5, right? But yes or no. In the area between the anus and the scrotum, in the area in the testicles or the scrotum, at the tip of the penis, not related to passing urine, but below the waist in the pubic or bladder area. In the last week, have you experienced any of the following: pain or burning during urination, pain or discomfort during or after ejaculation? Have you had severe pain or discomfort in any of the above areas in the last week? Never, rarely, sometimes, often, usually, or always. Then it goes into which number best describes your average pain or discomfort on the days that you had it over the last week. So 0 is no pain, 10 is pain as bad as you can imagine. So really looking at the pain scale there. And then we look at urination. How often have you had the sensation of not emptying your bladder completely after you finished urinating over the last week? I love that this question is here because so often we think that retention is specific to the female population. It is not. And it's important for us to explore that. So we have a not at all to almost always scale here. How often have you had to urinate again less than 2 hours after you finished urinating over the last week? So we're looking at frequency here. Not at all to almost always is the scale once again. This is about the impact of symptoms. How much have your symptoms kept you from doing the kind of things that you would usually do? So this is like a quality of life question. None, which is 0, to 3, which is a lot. How much did you think about your symptoms over the last week? None, which is 0, to 3, which is a lot. And then our last question is about quality of life. If you were to spend the rest of your life with your symptoms just the way they have been over the last week, how would you feel about that? 0 is delighted, 6 is terrible. So once again, the scoring here, we have a total score of 0 to 43. Higher scores equal more severe symptoms. There's no adding, dividing, or multiplying here, which is great. No scaling of the scores. So we're just able to go right into the total score, which I also really appreciate. For your insurance notes, the NIH Chronic Prostatitis Symptom Index was administered to evaluate pain, urinary, and quality of life domains associated with male pelvic pain or chronic prostatitis. This validated instrument provides a standardized method to assess symptom burden and track clinical improvement. Documentation of changes in NIH CPSI scores support medical necessity and evidence-based progress in male pelvic health treatment. And so once again, another nice reference for you to use there. Thanks so much for being part of this workshop. If you don't know me already, I'm Dr. Krystal Lynn Couture. My business is the Pelvic Acu, where we teach continuing education to acupuncturists who wish to specialize in pelvic health. Our Instagram, Facebook group, and classes links are available for you to see there.